One of the more compelling pieces of evidence or testimony in this whole debate has been what we've heard from folks around the country, what we've heard from our individual states. We just had I don't know if Sarah has that pile of letters, but we had a series of letters delivered from the ARC of Pennsylvania, which just over the last couple of days, pretty hefty sum there. And then other letters that went to the Finance Committee from Pennsylvanians and other states. So we're grateful for that. I think the process here, I think even folks who were supportive of this Republican bill would say that the process isn't in any way commensurate with the gravity of the challenge and the scope of this legislation. I would incorporate by reference what Senator Bennett said about what's been happening in the Help Committee. Some of the best bipartisan work on health care, maybe in a decade, moving towards a consensus and having 4 hearings just on those very limited number of topics, nowhere near the scope of this bill, and yet we had 2 weeks of hearings, great bipartisan work. We should return to that, get that bill done, and then maybe, I hope, move on to other issues. I don't think there's any question when you compare the hearing time either in the Finance Committee or the Help Committee on the Affordable Care Act, there's obviously no comparison. Once you get above one, of course, one hearing, you're above where we'll be tomorrow in this committee. 11 days of hearings in the Finance Committee over the course of the consideration of the Affordable Care Act, 26 hearings in the Help Committee, 147, the final bill incorporated 147 Republican amendments. So a stark contrast. And then finally, I'd say that in terms of process, we could move in that direction and have a series of hearings on this legislation or any other. But I know that there's a deadline that some want to meet, which I think is not the measure that the bill should be guided by, the September 30th deadline, instead of working over months on a series of hearings. I had a couple of questions that I just been wondering about, and I'll just throw them out more, I guess more as statements and questions. What I can't understand is the obsession that Republicans have on this committee, and it seems across the Congress, against Medicaid, or the hostility they have to Medicaid. I don't understand it. It's gotten me very angry the last couple of weeks and months because I care deeply about that program, to protect it, to strengthen it, to preserve it, that covers more than 70 million Americans, kids and people with disabilities, seniors getting into nursing homes. I don't understand that. And I also don't understand what is the big problem with 11 million people getting health care, in this case through Medicaid expansion, the balance getting health care through the exchanges. But why is that a problem? Why is that wrong? We all benefit when people gain health care coverage, and I think we're all diminished and, in fact, potentially injured when they don't. Do we want 11 million people to not have health care? Should that not be considered a measure of progress? Senator Toomey and Senator Santorum are here with us today, and I welcome Senator Santorum back to the committee. Know that in our state we have a huge rural population. We've got 48 rural counties out of 67. I spent a lot of time in the month of August going across the state, and a lot of those were those rural counties. And talking to folks there just about the opioid crisis, as Commissioner Miller, Secretary Miller, and others have said, just that alone is a huge challenge in rural areas. And in several counties, they said, thank God we have Medicaid expansion. Having the biggest impact on that problem, not a magic wand, not solving the problem totally, but people in Pennsylvania getting treatment and services for an opioid addiction problem solely because of Medicaid expansion. So I don't understand the obsession with winding down and ultimately getting rid of Medicaid expansion. So let me get to some questions, because I know we're limited time. We'll get another round. But I want to start with Secretary Miller. As Senator Bennett mentioned, you testified before the Help Committee, and when you reviewed the work that we were doing there, that you participated in along with governors and others, and then when you reviewed this legislation, did you find any evidence of the stability proposals that we were working on in the Help Committee? Did you find any of those in this bill, the Republican bill that we're discussing today?
Senator, the only provision that we discussed that I saw in this proposal is a reinsurance program that lasts for 2 years. But it's not going to be enough to stabilize the market without CSR funding, without the mandate, with the repeal of the mandate. Those things are going to seriously destabilize the market in 2018.
And just very quickly, I want to be observant of time, I'm over, but Secretary Miller, Pennsylvania expanded Medicaid. You understand that better than most. This plan would block grant the Medicaid expansion funding in 2019 and eliminate the funding entirely in 2027. Could you explain the impact this would have on Pennsylvania? And maybe on my second round, I'll ask Ms. Mann if you could do that from a national perspective. Could she answer that question? How about a short answer? Can we do that?
People waiting, yes.
Ask consent for a short answer.
I think the impact of these cuts will be devastating to Pennsylvanians. The governor has done everything, and all of us in his administration have worked very hard to make sure we expand access to affordable coverage for as many people as we can. And when we look at, even if you look at the conservative estimates, whether we're talking about $15 billion or $30 billion, which is our estimate, any of that range is going to, those cuts are going to have a real impact on people that rely on Medicaid for their health care.
Thank you. Just for the record, there was a reference earlier, or several references to the governors. That letter that they wrote, those 10 governors, bipartisan, the first paragraph they suggested not considering the bill. That's significant. But then they ended what I think is a pretty good summation of what we should all be doing. And I think we started this in the Help Committee. Here's the governor's second to last paragraph, quote, "We ask you to support bipartisan efforts to bring stability and affordability to our insurance markets. Legislation should receive consideration under regular order, including hearings in the health committees and input from appropriate health-related parties. Improvements to our health insurance market should control costs, stabilize the market, and positively impact the coverage and care of millions of Americans, including many who are dealing with mental illness, chronic health problems, and drug addiction." I think that's a pretty good summary of what we should all be doing. And I hope we can get back to that, but part of the predicate for that is this bill doesn't pass. So we've got some work to do this week. Ms. Mann, I promised that I'd come back to you with a question that I posed to Secretary Miller with regard to the what happens to Medicaid expansion. I asked her about the impact on Pennsylvania. In your judgment, based upon your experience, and I want to refer again to your time as both Deputy Administrator and Director of the Center for Medicaid and CHIP Services for CMS. What's your sense of what that means for the country? Just the winding down of Medicaid expansion.
Thank you, Senator. Well, first of all, it's not even winding down. January 1st, 2020, it
Right.
simply goes away. And some 11 million people that are covered under the Medicaid expansion, they simply will not have, the states will not have the legal authority or any ability to get federal matching dollars in order to continue them. The expansion has been enormously valuable in those states that have done it. Those are the states that have lowered their uninsured rates to record lows, and while the nation as a whole has lowered its uninsurance rates, particularly has happened in expansion states. But more than that, people have been getting care. Governor Snyder keeps a great dashboard in Michigan of how many people got mammograms and how many people got colonoscopies and how many people got preventive care. The Louisiana dashboard for their expansion, they got 433,000 people covered under their Medicaid expansion, and they can tell you how many people got preventive testing and then were found to have illnesses and then got the treatment for those illnesses. It's real people, real services. But in addition, it's lowered uncompensated care costs. It's really helped hospitals stabilize their funding. You saw the map before about rural hospitals being most affected in non-expansion states. And it's also helped state budgets as expenditures that a state might otherwise be needing to make now can be covered through the Medicaid expansion. All of that goes away if the expansion goes away.
One of the points that you make, which I think is of paramount concern to me, is just the guarantee of Medicaid. In other words, you could have a family that has, and we saw this in some of the reaction of folks around the country the last couple of months, families with high incomes, good health care, but who still need Medicaid because their son or daughter has a profound disability of one kind or another. So not only, I mean, all kinds of families benefiting from that guarantee. The last thing I'll say is, on page 3 of your testimony, you mention the taking away of that guarantee, and then you go on to talk about the other side of Medicaid, meaning the original Medicaid program itself. You say, the consequences of this major change in financing fall solely on those enrolled in the traditional Medicaid program, newborns and other children, very low-income parents, pregnant women, number 3, low-income seniors, number 4, and people with disabilities, number 5. And if you wanted to add anything to that in 15 seconds.
And that's the irony of this, because a lot of the criticism about the expansion, even though there are people at 10% of poverty, 15% of poverty, 60% of poverty, is that, oh, the resources should go to the traditional Medicaid program. And yet this bill would cut those resources and impose an arbitrary cap. So those pregnant women and those children and those elders and disabled individuals will not have that guarantee for funding, and the states won't be guaranteed that they'll be able to afford the kind of treatment that those individuals need.
Okay,
Thank you.
Senator
Thank you, Mr. Chairman.
Stabenow.